Alondra got diagnosed with leukemia in May 29. I took her just for her regular physical for preschool. So I went ahead and took her for her physical, and the doctor noticed that she was a little pale. Yeah, when we were at the hospital, they would tell that she was 3 going on 30.
Alondra's treatment has been very good because she's been tolerating the chemotherapy extremely well. She has kept her appetite up, she has maintained her energy, she is feisty, and I do believe that that's helping her fight through her cancer because of her feistiness, and that's what we love about her. She basically just takes control of the situation. When I walk up the driveway, I can tell she's been waiting for me, and she reaches out and I hand her the blood tubes, and then we come in and we have a special place where we sit all the time. And I give her the pieces that she's in charge of, and I do my part. And she's very clear on when it's her turn and what I should do. And so she keeps me in line. And I think that that's really important.
When I first saw her, she's fine, she's healthy, she's running around, she's happy, active girl. You know, she used to have the fair skin, but at the same time, she looked a little bit pale to me. So I tell Mom that, you know, I want to run some blood tests on her.
She knew that something was wrong and she needed a more complete evaluation. And as soon as I got those results, we made the call to Stanford and referred her up there. And Stanford was able to see her immediately, get her right into therapy, and made the whole process a lot easier. And partly this is possible because we have an ongoing relationship with Stanford.
A strong relationship between Salinas Valley Memorial Healthcare System and Stanford's Lucile Packard Children's Hospital means that children like Alondra are able to receive quality medical care close to home when they need it most.
Our relationship with Stanford started over 25 years ago because I know I've been the CEO over 25 years, and we've had a big push for university affiliation. And when I was graduating from UC Irvine and UCLA, everybody in those respective areas had strong university affiliations with major industry, and you gain a lot. It was an idea to, follow what other hospitals have been successful at, and that is, through partnerships that you could, gain more for people in your region, children that are so underserved. It gives a lot of comfort to the family.
Well, we've never done this before because no one in our family has ever had leukemia, so this was kind of shocking for us. But with Margie here, it's been great because she takes her time and she plays with her, and like you notice, she helps her with everything, and good thing that she lets her be involved in it because that way she gets more used to it and she's not scared. She knows what's coming.
I have had a long relationship with Children's Miracle Network. They've been very supportive since the day we opened our doors in June of '05. Our goals and their goals basically are identical. It's to improve the quality of children's lives on the Central Coast through keeping them at home as much as possible, keeping them out of the hospital as much as possible, and just making their treatment as pleasant as possible for them. So it's a nice match.
Well, if it wasn't for Coastal Kids, I would have to drive an hour and a half twice a week. It's just on my way of, it's a 3-hour drive back and forth. So if it wasn't for them coming over to our house, I don't know if it would be possible to be doing all that time.
Luckily, Alondra is very lucky. There's a couple things going for her. She's very young. Her doctor caught it very early, and she's responding to treatment very well. The side effects from her chemo are minimal. She has very bad days, but for the most part, she's doing beautifully. Thank you, sweetie. See you in a couple days, okay?